Hi, I'm Dr. Paul Clayton. I'm a visiting fellow at Oxford Brookes University. I'm here to talk about perhaps the most important breakthrough in nutrition that I've seen in my 30 years in this field. The introduction of a new natural compound called Wellmune and how it's being included in MonaVie Immune, the latest addition to the MonaVie range of products, and one which I think is going to make potentially a very major impact. This is a new natural nutritional compound derived from baker's yeast, which we now understand has a huge effect on the functioning of the innate immune system, your major defense against invading microorganisms.
What have we got to defend us against invaders? Well, the most important part of your immune system is the innate immune system. And the most important part of that are a bunch of cells that run around the body.
These would be macrophages and neutrophils. Highly active, you might say aggressive cells that roam around the body looking for anything that doesn't belong there. And if they spot an invading microorganism, they will target it, engulf it, and destroy it. It works like this. When an invading microorganism enters the body, the first thing it's likely to encounter is a nonspecific antibody, which will stick on to that invading microorganism. That triggers another reaction. Along comes a blood protein called complement that sticks on as well. And this complex now releases small chemicals that attract the innate immune cells. They come along and they have one receptor which binds on to the complex. And if that's all that happens, if you're lucky, the innate immune cell will be able to do its job. It'll engulf and destroy the invading microorganism. If it does its job, you'll never even notice. In fact, it's like watching a swan swim across the mirrored surface of a lake. It looks effortless. Underneath, the legs are going like crazy. That's the innate immune system. It does its job quietly, imperceptibly below the surface.
This system works pretty well, unless it has been compromised. And one of the things that compromises it is these compounds called beta-glucans, because over the millennia, the innate immune system has become accustomed to their face. It likes to see beta-glucans floating around in the system. When it sees them, it knows that it has to become optimally effective. And we used to eat a lot of these compounds. They were present in fermented foods, such as bread and beer. But changes in food technology took them out of bread and beer. And the introduction of fungicides into agriculture removed them from the rest of the food chain. That's a problem. In some parts of the world, people still eat traditional foods. This is in Turkey. And here is a picture in Kinshasa, which is on the west coast of Africa. And here is one taken in Udaipur. And what the slides don't show you is how dirty those environments are. Full of insects, rodents, all kinds of wildlife. People eat that kind of food. They don't get sick too often because they have strong immune systems, because the immune systems are continually challenged by compounds such as beta-glucans.
And in the absence of beta-glucans, the immune systems, the innate immune systems, become less effective. What we're doing here, by adding beta-glucans back into the diet, back into the bloodstream, we are reestablishing what was normal until 50 years ago. And we are thus supporting, enhancing, maintaining, call it what you will, the integrity and the optimal functionality of the innate immune system. By putting Wellmune WGP back into the food system, back into the blood chain, we are allowing the innate immune cells to do the job that they were designed to do.
I can talk to you about a number of studies that we've carried out at Biothera, who are the company that produced Wellmune, which is now being put into your very excellent product, Immune. This is a study where we were giving healthy community-dwelling subjects Wellmune WGP. It was a double-blind, placebo-controlled study, all the bells and the whistles that I would like to see and my scientific colleagues would expect to see. And what we were able to show, you can see here, in terms of general health, in the Wellmune group, it remains high at day 0. It's unchanged at day 90, whereas in the placebo group, it has declined, and that change is significant. And you can see that in the group that were given Wellmune WGP, there were no missed days of work or no missed days of school. So, to summarize, Wellmune, which is now being incorporated into Immune, what we know is that it is a natural product. It enhances immune function. It's safe. It has FDA GRAS approval. It's It's recommended for daily use. We know that you need to take it on a daily basis because those little immune cells keep on turning over, and you need to keep them all in good shape. We know exactly how it works. This is a compound with a unique proprietary structure. We've got a lot of clinical research, and I think it is important that we show that a product like Wellmune has the same health benefits that beta-glucans or Wellmune does on its own. And so, because I chair one of the scientific advisory boards at Biothera Pharma, and I'm working very closely with the scientific advisory board here at MonaVie, we are working together on a protocol for a clinical trial which will be double-blinded, placebo-controlled, all the rest of it. And we hope at the end of the day, well, fairly quickly now, to initiate this study. It'll be published in a reputable journal, and we will then be able to demonstrate to the satisfaction of anyone who is inquiring about this sort of thing that Wellmune has the same physiological and health benefits that Wellmune does when taken as a single capsule. And I can see a future not far from here where a large part of traditional healthcare would be taken over by the food industry, and that's why I'm here. MonaVie will be in pole position in this new movement, and I'm looking forward to being a part of that. Thank you very much indeed.